Dear students, welcome to GAIN, Gross and Microscopy Explained. On the screen, we are seeing the gross specimen of a tumor and its microscopic counterpart, the pleomorphic adenoma. So this is a university question in surgery as well as pathology. It can be asked as a short note, a slide, or it can be kept as a specimen. And quite a number of MCQs are probable. Before you go into the lesion proper, let us see. This is a structure of the salivary gland. In the salivary gland, let us remember that there are two components, namely the salivary duct. And the second one will be the acini. These are the two important components. We will be remembering them alone. And these are the cells, the epithelial cells and the myoepithelial cells. I repeat, epithelial cell and myoepithelial cell. This is the epithelium. And here I am finding spindle-shaped cells which are used for contraction. That is the myoepithelium. Please remember this alone. This is a beautiful hand-drawn picture of a pleomorphic adenoma in which we are finding. The word pleomorphic itself means that there are multiple morphological patterns. That is why pleomorphic. Here I am finding the glands or the acini, the ducts with secretions, and these are all the epithelial cells which are proliferating. What happens is there is a proliferation of the myoepithelial cell also. The myoepithelial cells, as they proliferate, the stroma also becomes edematous. So what happens is these cells become separated. They lead to what is called a pseudocartilaginous appearance or a myxoid area. So please remember this. Here is a cartilage because of the bluish tinge, and here is a myxoid area with stellate cells and edematous stroma. I again repeat, epithelial cells, ductules, ducts, cartilage, and myoepithelial cells with stroma. So this is the gross specimen. It is usually not kept for the undergraduates, but for the sake of completion. I am finding a glistening, well circumscribed tumor. It does not have a capsule, but the surrounding tissue is compressed as a pseudocapsule. And this is the normal parenchyma found outside. It is having a gelatinous and a glistening appearance. This we had explained already. Apart from the cartilage, sometimes there can be osseous areas as well. So please follow this. You will be able to answer even a theory question. This is the slide that will be kept for you in the university exam. Whenever you find a slide that is different from the others, it can be pleomorphic adenoma. It is not usually understood by the student. So I am finding the epithelium. So these are all the epithelial cells. As I told you, the surrounding myoepithelial cells, they will be having a stroma that is surrounding. So what happens is when there is more and more stroma, the cells get separated. So this is the myoepithelial region or the arrow. In some areas, the stroma is bluish, and I'm also finding finely vacuolated cells, which means they are turning into cartilage-like cells. So I use the word chondroid. Epithelial element, myoepithelial element, chondroid areas, myxoid, stroma. Again, in some slides, I'm able to see a lot of these epithelial components in one corner, whereas a large cartilaginous or a pseudocartilaginous area is seen. These vacuolated cells are resembling the chondrocytes, and the bluish stroma is a chondroid matrix. So section study shows tumor. Normal acini of the salivary glands are seen on one side, if at all you have a normal salivary gland. In this case, it is a complete tumor. The tumor shows nests of epithelial cells, and there is also a spindle cell stroma, stellate stroma, which are separated by myxoid and chondroid areas. So chondrocyte-like areas, this is the one. This is the epithelium. Please remember these three components: epithelium, myoepithelium, pseudocartilage. All the sources are from web pathology. Again, I hope you people can identify, try it as an exercise. Try to identify these components on the screen: epithelium, myoepithelium, myxoid stroma, and the chondroid stroma. This is yet another picture, a well circumscribed lesion. So slightly it is bulging out, but still there is a condensed pseudocapsule outside. It is having a glistening appearance because of the myxoid and the chondroid materials. This is a normal parenchyma that is seen. Sometimes there can be mild bossellation and extensions. So when the surgeon cuts it, he'll be cutting it in this area. Therefore, from the residual area, there can be a recurrence. This is very common in pleomorphic adenoma. See you in game 31.